Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. You know how you've been hearing that non-communicable diseases are gaining ground? Well, annually, 15 million people worldwide suffer a stroke. Of these, 5 million die, and another 5 million are left permanently disabled. And that's according to the World Health Organization. It's not that common in those under 40 years. However, stroke also occurs in about 8% of children with sickle cell disease. The absolute number of strokes continues to increase because of the aging population, but a lot of it can be prevented by lifestyle modification. My guest on the show is a consultant physician, professor of medicine and neurology, Lagos State University College of Medicine and Teaching Hospital, Professor Yomi Ogun, who joins us via Zoom from Ikorodu. You're welcome to the show, sir.
Thank you very much, Mary. Thank you for allowing me to join you this afternoon.
You're very welcome. Can you tell us what is happening to a person at the time that he's suffering a stroke? What is going on in his body?
Yeah, thank you very much. Maybe I will start from your first comment. That annually we have 15 million people dying from developing stroke and 5 million people dying. I think it's got into epidemic proportion now, and that figure has actually changed to 18 million, and it's even gone beyond that as well. Wow. Biblically, I mean, we look at stroke as as an ancient disease. Figure 6. If you try to spell stroke, I mean, and ask how many figures, how many letters do you have in stroke? There's 6 letters. Okay, it's a 6-lettered word. And the figure 6 is very symbolic, and it makes reference to the biblical book of Revelation, chapter 13, verse 18, that talks about 666, referring to stroke as a beast. The relevance of this is to say that every 6 seconds, okay, apart from being 6-letter word, every 6 someone is developed somewhere in the world. In fact, that 6 seconds we've said was as far back as 1999. From 2016, that's actually moved, okay, to every 3 seconds. And then on the highway that you're walking on the highway, every 6 individual that you meet on the highway in a lifetime will come down with stroke. Again, that has also reduced to 1 out of 4 as well. And every 6 seconds, someone is dying of stroke somewhere in the world as well. And again, on an annual basis, 6 million people will die from stroke. Again, this has also increased to about 12.2 million as well. And 6 million people will become disabled, and 6 million people will survive stroke. So the word 666 is very, very symbolic. I haven't said that also to emphasize that further. If you develop stroke, it's not malaria that will go in 3 days. It takes 6 weeks to 6 months for optimal recovery. And also going further again, still emphasizing the word 6, relates to the fact that there's a procedure we call endovascular thrombectomy. In other words, the pipe is blocked and the plumber needs to remove the pipe, okay, by using a plunger. That procedure must be done when you have about 3 parameters that relate to score, to 6. The NIHSS score must be more than 6.
So,
Prof, score more than 6.
Is that what happens? The blood vessel gets blocked?
Yes. In terms of, that's a wonderful question. Yeah. What stroke relates to? It relates to blood flow to the brain. Okay. Everything about stroke has to do with blood flow. So if we liken our brain to a plumber now, we'll be able to appreciate what stroke is all about. So what could happen to the pipe is either that the pipe gets blocked, as in what will result in what we call a dry stroke, or the pipe actually bursts, okay, leading to what we call a wet stroke. In other words, you have 2 basic types of stroke. One you call the dry stroke, the blockage of the pipe, which is cerebral infarction. The second one, of course, is the pipe has burst. So it will bleed into the brain. If you bleed into the brain, we say it's intracerebral hemorrhage. and you could bleed into the coverings of the brain, which we call subarachnoid hemorrhage. So you have the dry and you have the wet stroke. If I'm looking at trying to explain how stroke will come about, we can also simplify it by saying P in three places, three P's. The first P relates to the passenger, that's the blood flowing. The second P relates to the passage, that's the pipe. And then the third P relates to the power, that's the brain itself. Even when it comes to treatment of patients with stroke, we make reference to these P's, okay? The issue of the passenger, for instance, they say, oh, you must be on a blood thinner if you have the dry stroke, okay, to allow the blood to flow. And if you have the stroke and you present very early enough, within the first 9 hours, you can put some what we call clot busters, what we call thrombolysis. Just like a plumber, the pipe is blocked, it pours in a chemical there, but you must present early enough. The other one I mentioned earlier, endovascular thrombectomy, must be done within 24 hours in order to remove the clot as well. So all this relates to the passenger, okay, to allow the blood to flow. In terms of the passage, you need to strengthen the passage, but the passage could get blocked. There's something we call carotid endarterectomy, where you have the pipe so narrowed that you need to scrape the lining, as it were. And then there are also some medications like statins that work on the passage as well. The way it now comes to the power, I think this relates to the brain itself. And I think it's old school that we used to say, oh, the brain cells, once they're dead, they cannot regenerate, okay? Now we know they can regenerate. But even in adult brain, there's still some, what we call neuroprogenitor stem cells. And those stem cells can be stimulated and they will move to the site of injury. And they will lay new cables at the site of the stroke.
Okay, Prof, it's so nice that you have given us some hope in this grim situation. I'd like to ask, though, because you keep talking about time and how people have to present early and all that. So what are modifiable risks to this stroke? Because I understand that you can actually prevent it, some of it anyway.
Yes. Yeah, thank you, Mary, for the question. Well, talking about the risk factors, modifiable and non-modifiable, okay? The non-modifiable risk factors, I think topmost on the list, of course, is age, okay? Even if there are no other risk factors, I mean, the older you get, the more the chances that you are likely to be a stroke victim. So it's like you cannot eat your cake and have it, okay? So age is a key factor. Then you have, as a non-modifiable, then the sex as well, okay? The male sex, okay, is a risk factor to stroke. So being a male is a factor, and also, of course, being a black race. You see, the black skin is an enhanced genetic predisposition to stroke. So being a black person, of course, is a risk factor as well on its own. What we say of that, even we have the more severe stroke in the black skin, is also more severe as well. And then the outcome is also poorer in us as well. And then, of course, also occurs about 15 years earlier compared with the Caucasian. Averagely in this country, I think it's about 61, 62. So imagine, compared with the Caucasian, will be about plus 15, which will take it a lot higher. So those are non-modifiable risk factors. Then for modifiable risk factors, I mean, it cuts across hypertension, the leading cause of it. Okay, so if you're able to control your hypertension, then of course you almost be stroke free. Hypertension is the leading cause. Then of course, diabetes mellitus, okay, when you have sugar issues or any form of sugar abnormalities. Then of course, when you also have some cholesterol abnormality as well, okay, like what we call dyslipidemia, hypercholesterolemia, okay? And then when you're also very, very obese, okay, your BMI is very, very high, okay, it's also a risk factor, which is modifiable as well. And then going further, of course, smoking as well, and exposure to air pollution. I mean, those are leading environmental causes as well. And then alcohol, of course, has a role to play as well. Having said all that, I think the watchword is how we prevent stroke. There are 5 levels of prevention when it comes to stroke. The first level of prevention is called primordial prevention. What that relates to is to say, fine, make sure you do your exercise, okay, about 150 minutes every week, about 30 minutes alternate days at least. And then ensure that you take a lot of vegetables, you take a lot of fruits, grains as it were. And then you take less salt, and they also take less sugar as well. On this primordial dose is applicable to both communicable and non-communicable diseases. But then even the government can assist in this regard. They need to ensure that the factories, they give them guidelines and regulation as regards how much of sugar, how much of salt should be in the product as well. And they should put more taxes on such, so that at least such revenue generator, you can use it to take care of some of this. That's primordial.
Some experts say
primary prevention.
Okay, yes, continue, please.
Yes, well, for primary, that means you have hypertension, make sure it's controlled. If you control it, at least 40% risk will be reduced. You have diabetes, make sure it's well controlled. You have cholesterol problem. You have obesity, make sure it's well controlled. And whatever leading factor to it, okay? And then the secondary prevention, you have had a stroke before, and you want to prevent a reoccurrence. What you need to do is to take drugs like aspirin or clopidogrel, or you could even take statins as well. They assist in secondary prevention. Then tertiary prevention relates to a patient that has had a stroke. I will talk about the features you look out for in stroke in a couple of minutes. Has had a stroke and it presents early enough. It presents early enough. What we say is time is brain when it comes to stroke. And this is of essence, time is of essence. There are 200 billion neurons or cells in the brain. And every 1 minute that you waste, you're losing 2 million neurons. That's about 12 kilometer fiber length. So time is of essence. 2 million neurons every 1 minute.
That's remarkable, doctor. So you've always said time is of the essence when it comes to stroke. And those things to look out for, those symptoms to look out for to identify a stroke and act in time, we'll come to them right after the break. Let's take a short break now. Welcome back. This is Health Matters on Channels Television, and we're discussing how to prevent stroke. For those of you who were tuned in earlier, you heard the prof. Some of this prevention can stop about 40% of strokes from happening. You can call 0808-054-2233 for any questions you have on stroke. You can also tweet at CTV_Mary A, or send me email, moalale@channelstv.com, while we continue this discussion. Prof, you were about to tell me what the signs are of stroke. I understand there's an acronym called FAST. Do you still use that?
Yes, Larry, we still use that, but we've gone a little beyond that as well. And I think one of the things we encourage is to make sure that we help educate the public, community health empowerment, so that everybody at home, they all know the signs and symptoms of stroke. Because the earlier you present, the better. Time is of essence. Time is brain, and brain needs time for recovery. Having said that, what are the features to look out for? The first you mentioned is correct. Then we put the word word B before it, BE. So that means we're saying be fast. Okay, B says balance loss. E says high vision loss. Okay, F says facial asymmetry. I mean, you see the face turning to one side. And the A says arm weakness. The arm is weak, cannot lift the arm or the leg. And the S says speech impairment or speech difficulty. Patient cannot express himself or cannot comprehend what you're saying. And then T says time is brain.
Can I cut in there, Prof, and take this call from Yusuf?
Okay, yes.
Yusuf, are you there? What's your question?
Yes, good morning, Health Matters. My question to the Prof is this. In Yoruba land, when one has a case of hypertension, which may predispose to stroke, which you are discussing today, they usually say the person is overthinking. So I want the doctor to please clarify. Is it true that thinking, there is a way, there is no way one will not think about one thing or the other? does it really in medical this thing? Does it really
Thank you so much, Yusuf.
What?
Thank you so much. Prof, how much does thinking affect a stroke?
Well, thank you very much, Yusuf, for your question. Well, I think the truth is there's no life without stress. So we also factor to it, but it's not the primary cause of the stroke. It's a co-founder or a co-found, and it has a contributory effect, but not the primary cause of it. We all must go through stress. You mentioned the Yorubas. The Yorubas will say, okay, that means there's no life without stress. It's stress that keeps us going. So you can't run away from that. Be that as it may, not that you have to overburden yourself with stress anyway. I mean, that's the truth. So it's a co-founder to it. Then before you also mentioned the Yoruba as well, I quickly will add this. The Yoruba culture talks about, I think it's one of the cultural misconceptions which you need to clarify. A patient with stroke should not take injections, okay? That's it's not correct. I think there's a mix-up of poliomyelitis with stroke, okay? Stroke, Yoruba will say is ropa rose. Poliomyelitis will say romolapa romolese. So there are two different entities. In polio, no injections taken. But when it comes to stroke itself, you need to rush to the hospital. They need to give you an injection, which they give through the vein. So that misconception must be clarified. Okay?
Let's quickly take this call from Ada. Ada is calling. Hello, Ada.
Hello. Hello.
What's your question,
yes,
Ada?
Good afternoon.
Good afternoon.
From Joshua State. Can diabetes or stroke? Did you get my question?
I lost some of it.
Diabetes. Can diabetes or enlargement of the heart cause stroke?
Perfect. The prof will answer that question.
Yeah,
Prof.
Perfect question. Perfect answer. The positive answer is the capital yes. Okay. Hypertension invariably will cause enlargement of the heart, and there can be some irregular beatings of the heart as well. Okay, or the heart going into heart failure. Those can all contribute. Diabetes also is close to hypertension in terms of being a predisposing factor to stroke as well. So those two must be well controlled. They must be well controlled. Okay. Before we go further, let me also quickly say some of the other signs of stroke we need to look out for. Is if you try to spell stroke itself, STR. Okay. Then the S there saying can the patient smile? So you look out for any facial asymmetry. Okay. The T there. Can the patient talk? Okay, whether the patient be able to speak, and then the arrow there, can the patient raise the hand? So that's another way to remember what features to look out for easily. STR, S, can the patient smile? T, can the patient talk? And then R, can the patient raise the hand?
Okay, Prof, two quick questions for you.
Yes.
Sorry to cut in, but two quick questions for you. When you see a patient who hasn't started having symptoms, can you examine him in such a way that you can tell him, you're prone to having stroke, go and change your lifestyle? Is it possible? And the second one is, how many minutes does a patient have when he starts to have the symptoms?
Yeah, thank you very much, Mary, once again. Well, for the warning signs of stroke, there's a stroke score risk card a patient can even feel. Okay, and there's some app now as well, riskometers, stroke riskometers, which patient can even fill online to assess the stroke risk as well. Some of the measures they have to take. Okay, the internet has simplified all this. Having said that, one of the things about stroke is that hypertensive. You must be your doctor seeing you, of course, will assess that and see the effects on your heart. Hypertension damages 4 organs: the brain, the heart, the kidney, and the eyes. Okay. So you must look for all those complications setting in. Before they set in, we have diabetes, like we said, you must make sure it's well controlled. Your cholesterol is there, and there's a positive family history of stroke. That's another strong risk factor as well. Then you are very obese, they need to educate you in terms of lifestyle modification, less physical inactivity. Then you do more exercise, and you take less salt, you take less sugar. Some of these food items from fast food joints, they're very salty, and they're sugary, and they're oily as well. So we need to minimize that in that way. Having said that, I need to also remind the House, stroke should be prevented. There are about 10 Ds in terms of sequelae or complication that will come up. D in 10 places, though most words that start with D, usually not very pleasant, like damage, except for things like dear or darling. So the first one is death. 1 out of 3 will die. 1 out of 3 will become disabled. So disability. Depression is 30. Then dementia, well, after the first stroke, about 10%. After the second one, about 1 out of 3 again will develop dementia as well. Then they may have problem with swallowing. So they may have what we call dysphagia. Okay? And because of that, they may have dehydration. They don't have enough fluid as well. Okay? And then going beyond that, you also could have what we call DVT. That's the deep vein thrombosis affecting, you have like a kind of a blood clot in the leg. Okay? And that can get this blood from there and can block the breathing. End of story. And then you also have what we call decubitus ulcers. Those are bed sores, which they can develop as well. And then they can also develop what we call dysphagia as well. They have problem with speech. And of course, they could develop seizures. Okay, so changes and then seizures as well. Yeah.
There is so much to discuss. I can see that from the way you're taking your words. You just answered Grace Ofuani's question. She wrote by email and was asking about how do you know someone is going to have a stroke. But you've answered those questions now. We've run out of time. I have to thank you, and I must bring you back because this is so much. Thank you so much for coming to the show, sir.
Thank you very much, Mary, for having me. Really appreciate this effort. So I must say the World Stroke Day was last week, October 29th, okay? And that was very well celebrated. So we're just shifting this forward by 1 week.
Definitely. It's never too late and it's never too much.
Absolutely, absolutely. Thank you very much for having me.
Yes. Thank you so much for being on the show. Thanks for your calls. Beautiful calls, very meaningful. All of you. Have a wonderful day. I am Mary Alale Yusuf.